Hey folks, Doug Blake with Body Design University. In this video, I want to review some of the plyometric drills and some of the components, elements of plyometric training that ACE gives you in this particular chapter 11 or this part of chapter 11. And I'm really looking, I'm on page 498 because the question that I was asked was, do I need to memorize? This is what a student had asked me. Do I need to memorize table 1114? Well, depends on what you mean by memorize or how much of this you need to memorize. I don't think it's necessarily difficult because some of this is just I wouldn't say just common sense, but I think it's pretty easy to understand all of the different drills that they have listed here. Now there's 1, 2, 3, 4, table 11, 14, 498, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And you say, oh my goodness, 12 things I got to remember. No, don't worry about it because um, they're really pretty simple, straightforward, these lower body plyometric drills. Number one is jump in place. Okay. Can you jump in place? Sure, you can. Can you do jumping jacks? Yeah, sure. So that's two. Alternating push off, and this is less than 12-inch box that you would do alternating push offs, single linear jump, standing long vertical jump, single front lateral box jump, multiple linear jumps, tuck, front lateral, multi-directional, hexagon drill, diagonal cone jump. Okay, so first off, um, this is a sequence of tables that they're giving you. And so table 1114 can cause a little bit of, sort of distress as you're looking at it. But I did want to go over this because when I was asked this question, it really occurred to me that it's okay to learn this material, but what you must do, really, really important if you're going to use this with your clients or do anything plyometric training wise. Number one, are they the right clients? Because 99% of all your clients are not going to be doing or even need to do plyometric drills, to be honest with you. But what you've got to do is make sure you've going through this chapter, make sure you go back and you read the apply what you know box on page 496, jumping and hopping tips to ensure safety and effectiveness. As much as you want to know this table, or at least know basically what these drills are, you got to go back here and make sure you know all of these tips to ensure safety and effectiveness. And that's what I want to review with you. Number one, clients should land softly on the midfoot. You can't overemphasize the importance of when you're jumping. Again, you understand not everybody literally can jump. Not everybody should jump. From a safety perspective, you got a 60-year-old client, 65-year-old client, for instance, they're overweight, whatever the case is, you don't want them jumping. Um, Obviously. So, but ACE is really good when it comes to kind of understanding, remember um, their IFT model. Not everybody's going to move into this phase of resistance exercise training, but nevertheless, clients should land softly on a midfoot, right? And then roll forward to push off the ball of the foot. And that's basically what they're saying. Landing on the heel or ball of the foot must be avoided. So basically, what they're saying is that, this is the ball of the, right? These are your toes. There's the ball of the foot, and there's the heel. You don't want to land like that, and you don't want to land on the balls of feet. You want to land flat so that essentially the heel and the ball of the feet hit at the same time, and try to do it softly. By the way, doing it softly is not necessarily the foot, it's the knee and the hip that's critically important. Landing on the heel or ball of the foot must be avoided. These increase impact forces. Landing on the midfoot also shortens the time between the eccentric and concentric actions, i.e., the amortization phase. You learn that, thus increasing the potential for power development if another jump follows, which is kind of the whole point of plyometric training, right? So next one is ensure alignment of the hips, knees, and toes due to the potential for injury, especially in women. Why? Because of the Q angle. There could be increased stress on the hip particular in this case, and the knee. So the hip and the knee, it's always going to, they're always going to be the problems. You hit one, the other one is going to have problems as well. If you're doing something structurally unsound to the knee, you're going to feel it in your hips for sure. Encourage clients to drop the hips to ensure to absorb the impact forces and develop gluteal dominance. And they're telling you to say see page 432. Yeah, if I would recommend you do anything, is definitely understand the difference between quad dominance and glute dominance when it comes to squatting. It's critical. It's critical. It's one of the main teaching elements when I used to teach athletes in particular to do plyometric training. We were doing them off of boxes and different things, but it was critical to get them to lean forward, make sure that the knees bend as they hit, right? And they keep their rib cage up so that they can get that anterior tilting of the pelvis so that when they absorb that force, as soon as they hit with the foot, as soon as they hit and they absorb that force, you want the body to be in proper biomechanical position to get the next jump. But that absorption of those forces, you don't want that to be specifically just in the knee area. So that sort of soft landing must occur sort of simultaneously. And that's a really important component to teach somebody as they're doing plyometric training. Encourage clients to drop the hips, right? So as they come down, knees are bent, of course, and then the hips will absorb some of it. And that's because the rib cage is lifted up and there will be a forward movement, minor flexion at the hips, the pelvis. Client must avoid locking out the knees. I hope that's obvious. Come on, please, no locking at the knees. That jamming your tibia fibula complex into the femur, knocking out the knees upon landing, which leads to development of quad dominance. Well, yeah, sure, but I mean, come on, it's the risk of the two bone, the articulating surfaces, right, of the lower leg and the femur and the tibia fibula complex. If they're not bent, obviously you're going to have crushing forces directed through the joint itself. Poor landing technique can increase the risk of knee injuries. Proper hip mechanics during flexion and extension, along with the requisite muscular strength, is extremely important for developing lower body power, which is why it is recommended that clients go through the functional movement training phases before progressing to the load or speed training exercises, which means that for the majority, 99% of all of your clients are never going to do this. Okay. For the most part, unless you're training really fit individuals or athletes. And even then, it is very, very important that you do not overdo plyometric training. Quite honestly, when I was training athletes, it was sports specific. It was clearly sports specific. Swimmers did not need to do plyometric training. Never did it, right? It wasn't necessary. But other athletes, track and field, for instance, generally are going, and it depends on the sport, even in track and field. Instruct clients to engage the core musculature, right, which stiffens the torso, right, tensing the abdominals. And, again, that's the idea of the core is generally going to be the anterior or potentially the lateral components of the midsection, right? So rectus abdominis, yada yada, which stiffens the torso, protects the spine during landing, and allows for increased force transfer during the subsequent concentric muscle action, right? So I tighten up my core, my global musculature, all the intrinsic muscles. Hopefully, if you've lifted up the rib cage, and not arched fully, but at least created some arch in that lower back, so the intrinsic muscles of the spinal column and pelvic area, right, as they tighten up isometrically, they allow for the transmission of the force, right? So that that opposing ground force can now allow for a better jump, right? Hit, jump. Clients should land with the trunk inclined, like I said before, so the trunk leaning forward slightly, head up, torso is rigid. Personal trainers can cue clients to keep their chest over their knees and their nose over their toes. Nothing wrong with that. It's actually a good way to cue people. The point here is I want to make sure that when you're going through table 1114, for instance, and you're looking at all these, do yourself a big favor. Go back and read the apply what you know box. In the ACE textbook, there's no way around it. You do have to read some of these because they are connected, right? And so even though you're memorizing certain areas, you definitely want to go, like back in this case, definitely want to go back and read that, make sure you know that, and then apply it properly when you're training your clients. I hope this was helpful. If it was, type the word understand. Okay. Let us know if you got any questions on this particular topic or any other, and let us know how we can be of assistance to help you pass your ACE exam, particularly on the first shot, if possible. So have a great week. We'll see you next week. Bye.